Hi everyone, welcome to Ask a Navigator. Normal housekeeping stuff. I'm sorry, it's just me this week. We can't have. Well, maybe we could have Mars back, but I don't know if it wants to join me every week. Normal housekeeping stuff. Just me, but Southwest Center is more than just me. It's a collective wealth, for lack of a better word, of resources available to you, especially during this time, during COVID-19. We have teletesting available where you can schedule an HIV testing appointment. We'll ship an HIV test to your door or drop it off, and we'll have a tester meet with you over video chat to go over how to do the test, what the results of the test mean, and to link you to any care you may need. That care being, if you are HIV positive, we'll connect you with our wellness clinic and our early intervention specialist. His name is Michael. He's absolutely fabulous. If you test negative, we'll connect you with our prep navigators, Stephen or Gabriel. We also offer life coaching through our Clear Actions program. You'll meet with Adam or Giovanni to discuss your life goals and how to get yourself on track to the person you definitely want to be. We have our Ignite outreach team, including Jericho. Thank you so much for setting up this beautiful screen, Jericho, as you do every week. We have our condom distribution program where you can go to nicepackage.org and have condoms shipped straight to your door. All of this again is available digitally to you, so either over video chat or we'll ship it to you. We also offer certain appointments that don't require labs in our wellness clinic, so things like HRT, HIV care, PrEP, PEP, and we offer behavioral health, so therapy and counseling over video chat as well. I hope you're all staying safe as we continue on with the high COVID numbers in this state. Please wear your mask. And tonight's topic, hopefully it'll serve as a little bit of distraction to everything going on. I've been hesitant to do for a while, simply because when people think of trans, they often ask about surgeries. And I hope if you've been tuning in for the past couple weeks, you know that being trans is more than just surgeries. So as we continue on with tonight's, so weird in between time, isn't it? As we continue on with tonight's discussion, I hope that everybody feels empowered to ask whatever questions they want to ask, but please know that we are talking about people changing their bodies for their purposes. We're not, and I definitely am not, going to remove trans persons from surgical experiences. There's no objectifying to be had here. So ask whatever questions you may have, and if they could be asked in a better way, I'll definitely tell you. But we are here to talk about persons transitioning, not bodies being operated on. And with that, let's get to the questions. Oh, by the way, my name's Ian. It's down in the corner. I use he, him pronouns, and I am not a doctor. Maybe one day. But right now, I'm not a doctor. And so this is not medical advice. This is purely for educational purposes. If you have questions that need to be answered by a doctor or a surgeon, I will let you know if I think that needs to be answered by a doctor or surgeon. And it's always best to double check your assumptions with your provider. Okay, now let's get to the questions. I don't see any popping up quite yet, so feel free to throw them in. Otherwise, I will just ramble about everything I know, and I know way too much, more than a person really should, especially since I went down the TikTok wormhole of all the trans surgeries lately in preparation for this video, which there are a lot of trans surgical TikToks out there, like surgeons on TikTok. And I think that shows that I'm an elder millennial, that I just discovered TikTok, and I'm quite obsessed with it. Oh, while we're waiting, I suppose we could start with, there are some common terms for surgery that I think trans persons generally understand, trans or non-binary. But cisgender persons, you may be unfamiliar when we mean by certain terms. Like, for instance, when we use the term bottom surgery, we're not talking about our butts, usually. Usually we're talking about something below the belly button, generally. For transmasculine individuals, this could be a metoidioplasty, a phalloplasty. If you don't know what those words mean, we can unpack that later. Feel free to ask a question. For trans feminine individuals, this can include a vulvoplasty or a vaginoplasty. Yes, those are different things. It can include urethral lengthening. It can include the releasing of the ligament that holds erectile tissue in place. Top surgery generally means everything above the belly button. So a double mastectomy. So sculpting the chest to either look more masculine or more androgynous, or just reducing chest size, and a breast augmentation for the reverse of that. Oh, question. Are there types of surgeries that are often not covered by insurance? Yes. So up until recently, a lot of trans surgeries were not covered by insurance if they were deemed a trans surgery. So for persons who are assigned female at birth, they often could not get a mastectomy if it was for the purpose of creating a male chest. If it was for the purpose of cancer, then it was definitely covered. Same with vaginoplasties, vulvoplasties, phalloplasties, metoidioplasties. All those bottom surgeries often were covered. Then things started changing and insurance started covering more and more. However, now what I see when I help most persons pursue their surgeries are that the transmasculine surgeries, so those surgeries that are meant to have more quote-unquote male characteristics, creating a phallus, removing a vagina, and sculpting a chest to look more masculine, somebody's chest to look more masculine, those are covered way more than trans feminine surgeries. And there's no really rhyme or reason to it. Like in my personal opinion, a trans person who has their breast tissue removed is in the same need as a trans person who needs breast tissue. That's the same level of severity of surgery, the same treatment option. It's just two different directions. But transmasculine surgeries are often more covered and more comprehensive than trans feminine surgeries. And the only reason why I can possibly think that is that our society deems that it is more okay for somebody to want to be a man than to want to be a woman. And if you want more unpacking of this, I highly recommend that you check out Julia Serrano's work, Whipping Girl, where she was the person who popularized the term trans misogyny, where trans women are only viewed as women when it hurts them and not when it protects them. And in this case, with surgeries, we are more accepting of trans identities. And by we, I mean insurance companies are more accepting of trans identities when they're masculine or transitioning to masculine. And I've seen every excuse in the book for a trans feminine person and not being able to get the coverage that she needs. And every time, like, I try to file an appeal or extension, I get the weirdest excuses. Like for a breast augmentation, my client wasn't covered because she was slightly larger than an A cup. For those of you who don't know bra sizes, cups are not ubiquitous across bra sizes. So if you are a 36C, you are actually closer to a 34D and a 38B than you are to another C cup. C cups and the size around your chest are a ratio. So if I have a trans woman who is 6'1" and has an A cup, she has next to no breast size. She has breast buds. After years of estrogen therapy, she needed the breast augmentation and feel more like herself. But because somebody set this arbitrary standard, likely someone who had never worn a bra, they thought, well, an A cup is not that much, so I guess we'll cover anything that's above an A cup, we won't cover it, and anything that's under an A cup, we will cover it. But an A cup on somebody who's 4'8" is pretty reasonable. 4'8" and tiny is a pretty reasonable sized breast compared to somebody who's 6'1". It's the intersections, again, we've talked about intersectionality in the show before, but it's the intersections of being feminine, being a woman, and being trans that put my clients in a lot of difficult positions. So yeah, I often see that trans-masculine surgeries are covered, but trans-feminine surgeries are not. And it sucks. And a lot of trans-feminine supplemental care, like laser hair removal, often isn't covered too. Oh, another question. Can someone be trans but not elect to have surgery? Yes, you can be trans any which way you want. So if you want surgery, great. If you don't want surgery, great. If you don't know if you want surgery, great. You can still be trans. We don't have rules. The only rule we have is that you're not cisgender. And how you define that, honestly, I think you just have to have a conversation. If you are a trans masculine person, if you are a binary trans man with double D breasts and like 34 double D breasts that are pretty prominent, but you love your body, more power to you. If you are a binary trans woman who loves her penis and wants to continue using it and doesn't want a vagina, more power to you. Y'all are sexy. You all are wonderful. Y'all are beautiful, and y'all are valid. Ooh, lots more comments. What are some ways to prepare physically, emotionally, etc. for surgery? Good question. And as always, a complicated question. I think a lot of that is taking inventory of where you are in your transition and what's around you. I'll use my own surgery as an example. When I was 19, going on 20, I started looking into top surgery. Thankfully, testosterone had removed a lot of my tissue, but I hated binding, and I was actually pretty well endowed. So I needed to be able to breathe, and I was able to pay whatever cost, and I kind of just blew through the whole prep process. I got 3 jobs. I started saving money, starving myself, didn't care, didn't look into insurance too much. I was told that it wasn't covered, and I didn't expand upon that. I took that at face value. And I found whatever the closest surgeon was and just dove straight in. I didn't really prep at all. I just was focused on the end goal. I didn't even prep for the recovery. I didn't look into what the recovery would even be. And that was to my detriment. So I may have called my insurance company, but I didn't think to ask under what circumstances might a top surgery be covered. And there were some, like I would have to change my gender marker and everything, but I was planning on doing that anyway. When it came time to recover, I'm so lucky I had the friends I had. Like, thank you so much, Kari and Wolf and Mama Wolf and all those people who were there. Y'all saved me. I was a little baby who couldn't lift up anything, was not prepared for that. So I didn't really spend the time thinking about what I needed. And I encourage you to think about what you need. So if you're in a situation where you do not have thousands of dollars to spend, look into some cost saving options. Does your insurance cover it? If it doesn't, can you get an appeal? Can you do fundraising in your community? For a while there, chili potlucks before COVID hit were really popular here to raise money for surgery. Are there ways you can find the equipment you need for recovery that's been used by other trans persons? So I know that one of us who's had surgery has at least a half empty bottle of HIPAA cleanse that's going to go to waste and you're going to need it. See if you can get something secondhand. I have a wedge pillow somewhere that any trans person is welcome to. It's stained, but it doesn't smell. It's great to prop yourself up after surgery. If you need to travel out of state, can you find places where you can stay that are more local? And when it comes time to going to the consult and things, are you comfortable with your surgeon? Do you trust this person while you're unconscious? Do you think they'll do their job? If not, find a surgeon who will. Find a surgeon you can trust. Find a surgeon you know will be there for you. For the recovery, look on different trans forums like Facebook. There were a few on Tumblr, but then Tumblr went to hell. Reddit is a great resource. TransBucket has been falling apart for a number of years. They've all moved to different social media platforms. Connect with your trans community, connect with your trans siblings, and ask if they have any advice. I can't tell you how many documents I found about questions to ask about recovery of surgeons that I would have never thought of. And it's this collective amalgamation of persons writing up these questions on social media sites, or useful things they found, or how to get around different insurance things. Connect with other people who know in preparation for your surgery, in preparation for recovery. And when recovery comes, be ready to take off work, save up money, not just for the surgery, but also the time off work. Be ready to take off school. You will be tired. If you are not tired, you are the lucky few. But if you are tired, that's normal. See if you can borrow or invest in a recliner or wedge pillow. Ask if you're having top surgery, and that includes breast augmentation. Make sure that you have gum and wet wipes on hand if you cannot shower. All of these things I learned not from my own surgical experience, because that was a disaster, but from looking at different foreign things. So think about what resources are available to you. Think about what you need. Ask questions. If you feel like you don't have a firm foundation with your surgeon, with the supplies you need, with your finances, you know that you need to fill some gaps somewhere. And if you need help with that, reach out to me. I've worked with more insurance companies than I can count. I call at least 3 a week. I work with persons who are surgeons. I work with surgical associates. I've called Dr. Mosser, Dr. Garamoni, University of Minnesota, University of Utah, Dr. Meltzer, Dr. Lay, Dr. Trickletop's office. I'm fairly sure they're all sick of my voice. If you don't even know where to start, just start Googling and connecting with other people. And you can reach out to me too. Give yourself time to prep, because then you'll have a more quote unquote successful surgery and an easier recovery. And a lot of that is just self-evaluation. Oh, everybody loved Mars. I saw that. Comment if you want to see Mars again. So many people want to see Mars. This is awesome. Oh, Mars is in the comments. Mars, it looks like you have to come back. I'm sorry. We're going to have to stir up more trouble. What is a realistic timeline of someone being able to get a surgery? I'm not sure what you mean by realistic, but on average, a lot of my clients take a year. That's because there's multiple moving parts. The asking for time off work, the getting insurance coverage if you don't have it, the going through the pre-approvals process, the getting the therapy letter, the talking with the surgeon, the waiting for the surgeon wait list, the getting to the surgical facility, the setting up resources, and time for recovery. Usually, on the ideal timeline, it'd be within a month or two. And I've had some clients who have that, but they also have a lot of resources. If we think about Caitlyn Jenner or persons who are more affluent, they were able to pursue their transitions relatively quickly. But for about the average amount of resources, so somebody who is insured with private insurance in Arizona, already has a primary care provider, is pretty well connected with the community, I find that to be 6 months to a year, and it usually ends up being a year for financial and surgical booking reasons. COVID has messed all this up, by the way. So many of my clients' surgeries were canceled because of COVID, or postponed. And so that adds multiple months. And for those who had their surgeries pushed back, I really hope they can fit you in before your deductible resets. If they can't, I recommend that you appeal, any sort of like charges you get, because you should have had your surgery this year, and if it gets pushed back to next year, even though you had it scheduled this year, there should be some sort of compensation for that. And it never hurts to ask. So it's just those moving parts. If we think about it too, a lot of those moving parts are really unnecessary. So first off, deductibles should not be that expensive in the United States, in my opinion. Like, it's completely unreasonable that $5,000 should come out of a person's pocket before they get care. That's my opinion, but pretty sure a lot of y'all agree with me. Second, getting the time off work here shouldn't be that high of a barrier. This is a medically necessary procedure, and so we should be able to use sick time. Some companies won't allow us. We should be able to use paid time off. We should have insurance plans through our employers or through the state or what have you that cover these surgeries in full, like just as much as they would cover any surgery for a cisgender person, because they're not cosmetic. Like I said, they're medically necessary. Right now, Arizona Healthcare Cost Containment System, our state Medicaid, has a whole bunch of plans like Mercy Care, United Healthcare, Care First. None of them cover trans-affirming surgeries, gender-affirming surgeries. There's actually a clause in the Arizona Administrative Code that says that these surgeries cannot be covered. That inherently is discriminatory. Medi-Cal covers it. Wisconsin Medicaid covers it. Multiple states cover it. If you look at the Movement Advancement Project, MAP, they have a whole list of all 50 states and territories and what Medicaid states cover it and which ones don't. I cannot tell you how many persons from Arizona have transplanted themselves to a different state for a few years just so they can get surgery. They have ripped up their whole lives to move halfway across the country sometimes to get surgery. That should tell you right there that it's necessary. And in that case, that extends that timeline even more. But if we had insurance that covered things, if we had employers that understood the need for time off, if we had accommodations at work so that we can go back without undue pain or process. Like if you work in an Amazon warehouse, maybe they can find something for you to do where you don't have to lift 5, 10, 15 pounds over that amount for a certain number of weeks. If we had surgeons more readily available and trained surgeons who did good work, who people trusted, that would open up wait times. If the prior approval process didn't include a therapy letter, we can skip a whole part of the prior approval. If we lowered cost, it would increase access and more people would be able to get it more frequently. Right now, the average is about a year, and that's unacceptable. That should be a few months, max. What are the best, most effective ways for a non-binary person with access coverage to obtain a breast reduction removal top surgery? Like I said, the Arizona Administrative Code actually has a subsection, and I don't remember off the top of my head, that says that any gender-affirming surgery cannot be covered. I know mastectomies may be covered under other things, like cancer and things like that, but that's not something you want, and that's not something you can necessarily control. I think if you found a medically necessary reason that wasn't transitioning, and there are few and far between, then it might be covered, but it probably wouldn't be covered in full. And there are different parts of the surgery, so different procedural codes. So there's the cutting everything open and removing stuff, but the stitching down and the nipple grafts and things like that, that's a red flag a lot of time that it's a trans-related surgery, and they may deny the whole thing and you'd be out thousands of dollars. Best advice I can give is that some Medicare plans, so if you qualify for Medicare, some Medicare plans may cover it. If you're unable to work and you're on disability. If you are able to work and are able to get a part-time job, I know it's really difficult in the pandemic. Starbucks employees working part-time qualify for an Aetna plan. So if you can work about 20 20 to 25 hours a week, you can get on their Aetna insurance, and then that insurance should pay for your surgery. There are other financing options available. There are grants like I hope I'm not butchering the pronunciation on this, the Broadway Gatlin Spectrum Grant here in Phoenix that helps pay for trans person surgeries. Trans Lifeline has a whole bunch of micro grants to cover different expenses. 0.5cc Foundation helps persons afford surgeries. Access right now, I don't think is really in a place where we'll cover anything. I've heard some anecdotal stories that persons have gotten things covered, but it's written in such a way where even I, like the master of loopholes, cannot find a way around it. If you want to eventually get that change, I recommend that you connect with a local organization like Equality Arizona and see how you can get politically involved to basically lobby for your cause. I know last year, I think it was last year, I got to speak to senators and representatives on the state level who write these legislations. And oftentimes they write them without ever having met a trans person. Write your local representatives and say, like, look, I don't know if you're aware of this, but I can't get healthcare here. I cannot get necessary healthcare. And this is not something that's happening on a federal level. This is something that's happening on a local level. So local elections are really, really important. Pay attention to them. Get involved. Write your local representatives and senators. Right now, Arizona has a trifecta, a Republican governor, a Republican Senate, and a Republican House. But last I checked, it wasn't by a really great margin. You might be able to get people who are willing to be advocates for you. Politicians are public servants. They're there to serve you, but they need to know what you need. So if you want to change this for the long run and help a whole bunch of people, get these people involved on your behalf. That's the reason why Medi-Cal, California's version of Access, and AppleCare up in Washington, cover these surgeries because they removed those restrictions. It's possible. It's going to take a lot of work, but we got to start somewhere. There's a supplemental question to, can I be a trans person and not want to have surgery? We went into that. Yes, you could be trans and not want to have surgery. Do I have to change my body to be trans and be accepted? You do not have to change your body to be trans. To be accepted, this is not for you. This is for everybody else who thinks that you need surgery to be trans, including binary trans people, I've noticed. We need to stop this. We need to step up and let our siblings who love their bodies have space in our community. We need to understand that just because somebody doesn't experience dysphoria and somebody doesn't want to go under a procedure that costs thousands of dollars and has a lot of recovery time and may be dangerous for them. We don't know people's medical histories. They are just as legitimate as those of us who choose to have surgery. We need to stop picking on each other and start coming together and make effective change for all of us. I saw a comment here. Feels like I'll never be able to get FFS covered. I'm sorry. So for those who don't know, facial feminization surgery, FFS, is one of those surgeries I was talking about earlier that often is not covered. It's where the intersection of being a feminine person meets the intersection of being a trans person. Insurance companies often find this discriminatory. And it blows, like, often are discriminatory when it comes to this coverage, where they won't cover this. And it blows my mind that even the most inclusive insurance companies are willing to pay for a vaginoplasty and a vulvoplasty, which has nothing to do with, I would argue, 90% of the people trans feminine persons encounter. But your face does. I know that one of the most validating points of my transition is when my cheeks dropped and when my jaw grew in. That made me feel really masculine. And I think that because testosterone changes those features long term, somebody who has gone through a natal masculine puberty with testosterone and then needs facial feminization surgery deserves to have facial feminization surgery. That's medically necessary, like I said, and I feel your pain for not being able to get it covered. I know that I'm doing all I can to advocate for you. I encourage you to advocate for yourself. For any cisgender persons listening, particularly those in positions of power of choosing insurance policies and coverage. So say you work in HR in a company, or you work with insurance brokerage or what have you, please read through your policies and think, does this cover trans feminine persons as much as it does trans masculine? Would this serve in helping somebody become more womanly as it would for more manly? And that includes facial feminization surgery. To the person who paid the comment, if you are currently employed and have private insurance, talk to your HR department. Get an ally in there. Explain your story and explain your needs. I have seen wonders happen through appeal processes, and I've also seen amazing things happen to changing policies. So they can change the plan. I used to work at an AU, and the staff health insurance plan was discriminatory to all trans care. They wouldn't even cover hormones. But a whole bunch of us, some of us more level-headed, I was not one of those persons, than others, met with the LGBTQIA commission there, who then lobbied the university to cancel their contract with Blue Cross Blue Shield until they covered trans care. There was a lot of heeing and hawing and back and forth, but ultimately it came down to NAU threatened to pull their contract, and Blue Cross Blue Shield yielded because that was a lot of money for them. And so your company does have power over what insurance they choose, and they can strike a deal, and they may have to pay a little bit more, but you as an employee are totally worth it. Building allies and persons who can carry your message to the board and carry your message to insurance providers is super important. It's so that people understand why we need these things. When they see trans, they think just genitals, but we're more than that. And our faces are some of the first things that people see. So explaining things that way and getting people on your side definitely helps. And I know across several states, I don't know in Arizona, but across several states, there are many, many trans women. I don't think any non-binary persons yet, but many trans women who have started legal battles to get facial feminization surgery covered. And I know of at least 2 who have won. I don't know them by name, but one was earlier in the Midwest this year. And one won a case, but it's in the appeals process now, I think, in California. So there is hope, and it may take a super long time, and it feels like it may never be covered right now. But I was thinking that for my top surgery, and now it's one of the things that's most predominantly covered. We're also getting better at making these surgeries more readily available to all persons, which means they'll be cheaper, which also means that insurance may cover it. So please keep the faith as much as you can. And if I can help in any way, let me know. I often see people having to fundraise for surgeries. Are there any organizations that help offset the cost of co-payment deductibles or covered surgeries? So the Broadway Gatlin Spectrum Grant, 0.5cc Foundation, off the top of my head, there are several other ones. I know that places like fallow.net, topsurgery.net, mtfsurgery.net list different fundraising organizations on their financing page. I've also seen persons take out small personal loans. Oftentimes they use things like care credit, where be careful, but it can be a good stopgap for a deductible. So if you have to pay $3,000 toward your deductible, so it's covered, your surgery is covered, but you have to pay that $3,000 first. What you can do, and financially plan carefully, is you can get a care credit card. And depending upon care credit's introductory rates, if you rack up $3,000 on that card, so you swipe it, $3,000 charge, you have, I think, 18 months. Check care credit for their most recent deals, but 18 months with 0% interest, so no interest is charged, to pay off that $3,000. So if you want surgery, like you know your insurance now is going to cover it, you just need to fill this, you can pay off that $3,000 over 18 months. You can also save it up over 18 months and then pay for it. I know I say this, and I say the financing and different options. I know many people have picked up second jobs to afford surgeries, or third jobs in my case. I say this not to be discouraging. You're entitled to have surgery without a lot of hassle, but to be more realistic, these resources for trans persons that help offset the cost of surgeries are often maxed out. Usually within minutes of opening the application closes down because they have so many submissions. Last time I checked into the Jim Collins Foundation, when they were like opening and closing applications, the site crashed twice. There are a lot of people out there who need a lot of help. So don't bank on being the one who's chosen. Give yourself multiple options. And if you are chosen, awesome, great job. One thing I do encourage you to do is pay it forward. I know that there are many trans persons in my community who have worked with different organizations like the Phoenix Boys of Leather and the Phoenix Girls of Leather to raise money for trans persons. Not necessarily surgeries, but last year the Phoenix Boys of Leather did a fundraiser, Wax-A-Bear, where we raised money for Southwest Center's PrEP Fund and for helping persons change their documents. If you are privileged and fortunate enough to get change, to have change, share your joy. Talk with people about how much better your life is after surgery, why it's so essential. Be upfront for helping fundraise for others, because it's really impactful when we say, yes, this is medically necessary. The American Medical Association says it's necessary. The American Psychological Association says it's necessary. The World Professional Association for Transgender Health says it's necessary. The University of California, San Francisco says it's necessary. All these really important institutions say it's medically necessary, and insurance is kind of covering it. But all that, in my experience, fails in comparison to one voice saying, my life is infinitely better after getting surgery. This changed my life to where I'm able to do this, and I'm able to do this, and I'm able to do this. That resonates with people in such a way where they just start shoveling cash at you. And that cash is, and that story you can use to raise cash for your siblings. So don't let the privilege and fortune end with you. Use it to help others. You talked about may needing an appeal if my insurance, maybe needing an appeal if my insurance does not cover it. Can you talk about that process more? So, working with insurance, this needs to be its own video, but here's a short tutorial. Working with insurance is difficult, and they're going to try to give you the runaround because that's a cost-saving measure. Don't let them. Instead, what I like to do is write out key points and key questions you have to have answered. Is this covered? What am I responsible for, and what's the process I need to get covered? If it's not covered, ask, can you point to where in my policy it says it's not covered? And they go, well, if you just search, no. I need you, the other person on the phone, to do their job and show me exactly, actually better yet, email it to me. Email it to me where it's covered. If you can't tell me exactly what page and what paragraph it's on, I need you to email it to me. Okay, you find the exemption, you see how it's worded. What I usually then do is read over it with the person on the phone, and I hear how it's not covered. Sometimes the clerk doesn't understand on the other end that it is covered, you just need a behavioral health clearance letter. Then you get a behavioral health clearance letter and you send it to the insurance company and it should be covered. You get past that, it says it's not covered under any circumstance. They don't view it as medically necessary. This is a cosmetic procedure. Then you escalate it. You thank the clerk for their time. Say you have a little bit more questions about the appeals process and some more things. If they're not familiar with that, can they please transfer you to a manager? They'll go, oh, I want to transfer you to the appeals department. I don't recommend that right away. You want to talk to a manager. Talk to a manager, have them pass you up, and say, okay, when you're on the phone with them, make sure you get their name, the time you called, and the call reference number. So before they transfer you up to a manager, get the call reference number. If the manager does not pick up within 25 minutes, call back to a different clerk, say that you've called, the manager didn't pick up, that you've been on the phone for 25 minutes, that you have the call reference number from the previous call, and that you've talked to this person, and that you would still like to speak to the manager. Because now you have not just a request, but a complaint. If they say, okay, let me transfer you to the manager, go, okay, I need you to check back in 5 minutes. If they check back in 5 minutes, great. Eventually you'll get through to the manager. You want to go through that same process you did with the clerk with the manager. Clerks are entry-level employees. Sometimes they're newer than others. Maybe they don't know a ton. Some are more seasoned and know a lot more. The manager should know more about how the policy works. You'll work with the manager to verify that there is an exclusion, and then ask the manager, what number do I call and where do I send a letter for an appeal for coverage? The manager should give you the extension of the appeals department. They should give you a PO box number where you can submit some documentation, and ask, do you have any advice for when I submit this appeal about what I should say and what I should do? And can you also point out where in my member handbook the appeals process is delineated? They should do all these things. If they don't, if you keep hitting dead end after dead end after dead end, hang up the phone, collect yourself, reward yourself with a smoothie for dealing with bureaucratic nonsense, come back and write up a very tasteful letter. Google the appeals department for your insurance company and send that appeal letter there. If you don't hear anything back within a week, start raising hell. Go to your HR and say, look, of all the things I've done and how I was treated, I sent in this letter and I didn't hear back. I did this and nobody got back to me. Your HR should advocate for you. If your HR is not advocating for you, go to the corporate branch. So if it's United Healthcare, don't bother with your plan and go straight to United Healthcare and just keep talking and talking and talking. You will eventually find somebody who is going to be, one, super embarrassed by their employees' their personnel's behavior, and they're going to want to help you. And you have found yourself in a position that you can definitely leverage. You can leverage it to get your coverage. If your appeal process is all hunky-dory throughout and you submit your letter and the appeal is still denied, keep appealing, keep talking, get reasons why, and then ask for a board hearing. So they should have you meet with somebody like a care navigator, a care coordinator, a case manager at the insurance company where you appeal your case. And you can keep doing that and doing that and doing that. Usually with my clients, one of two things happen. One, the next year their insurance comes around and the exclusion is somehow magically gone. Or two, they fight enough to where the insurance company as a whole reevaluates their policy and changes it. Or three, they get a one-time coverage exception. I've only gotten to the third one-time coverage exception once. Most often the policy is changed. And final note, say you do all these things and you still don't get your surgery covered. All that's documented. So when the next trans person comes along, they're not the only one. And then the next one after that, and the next one. When we look for coverage for our surgeries in the appeal process, we have to be thinking about more than ourselves. The more of us speak up about our needs, the more of us that file these appeals, the more of us that raise hell with these organizations, the more likely that future trans siblings will get what they need. And that benefits us all in the end. A lot of issues I run into with insurance and appealing and things like that is that people just don't know. Like, we hear that a lot with the trans community, that people don't know. And I take that with a grain of salt. But for insurance coverage, it's one of the few places where people really just don't know and don't know how important it is, because the only way they can educate themselves about it is seek out trans voices. And that's not something that a cisgender person does naturally. I mean, they may stumble across Disclosure on Netflix or Pose, but that's not something they're going to be thinking about when they go to work at their insurance company or when they pick out a policy for their employees. We have to speak up. I was told I need a letter from a therapist. What does my letter need to say, and why do I need one? So you need one because transphobia. You need one because oftentimes a lot of historical models of care were based on making cisgender persons comfortable instead of helping trans persons. So unfortunately, at one point in time, there were a set of criteria that were created in order to verify that somebody was ready for surgery. And those criteria are 4. You are the age of majority. So in the United States, you are above the age of 18. you present with gender dysphoria. That in and of itself is problematic, and I probably want to invite a professional onto this platform before we get into it. But gender dysphoria is a diagnosis from the DSM-5. It used to be called gender identity disorder. Being trans is not mentally ill, but you need some sort of diagnosis of some sort, and that's a diagnosis you need in order to get your surgery covered. That any comorbidities you have are reasonably well controlled. So if you have depression and or anxiety, like you're doing something to treat that. Like you may be pursuing surgery to help with your dysphoria, which triggers your depression and anxiety, reasonably well controlled. If you have HIV, you're on meds and you're undetectable. If you are, if you have hemochromatosis, that your hemoglobin and hemoglobin are fine. If you have a bleeding disorder, you have some sort of clotting factor or some sort of treatment plan that helps. So any physical or mental illness is reasonably well controlled. Fourth one, you have the ability to give informed consent. So for persons who start hormones, you've shown the ability to give informed consent. Like they can just write that you did, like you started hormones. For those of you who are pursuing surgery without hormones, and yes, there is no prerequisite for hormones before surgery. It is recommended in some cases, but it's not a prerequisite. For persons who do not pursue hormones, you just have to establish the ability to consent to what happens to your body. That just show that you have some sort of decision-making process about your body. I've seen letter examples where persons have consented to getting piercings as an example of the ability to give informed consent. The only time this is really difficult to prove, the informed consent, is if you have a severely mental ill diagnosis and your guardian, you are assigned a guardianship legally. If that is the case, then your guardian needs to consent for you. So it's a little bit more of an arduous process. If you need help, like figuring out how to word that in a letter, I have a template this is for the providers out there. I have a template you can use, or you can go to Transline, or you can go to University of California, San Francisco, and they will walk you through it. But the best letter resource I found is the Gender Affirming Letter Access Project. It was created by trans and non-binary medical and mental health professionals as a harm reduction guide to letter writing. The reason why you need a letter is because it's a very easy way for an insurance company to create a gate for you to get to surgery. Providers out there, it is your responsibility to make that gate as easy as open to possible, as easy to open as possible, while still ensuring that you do your due diligence as a provider. Gallup has a great harm reduction guide for free at Gallup, GALAP.org, that you can read over, that shows you how to write letters in a trauma-informed, client-centered way. So you need a letter because institutions of far past made these certain criteria to get surgery, and insurance companies are using them right now to kind of create a gate for care. And it needs to include the fact that you're the age of the majority, that you have the ability to give informed consent, that any comorbidities are well controlled, and that you present with gender dysphoria. If you need a letter, like you don't have a behavioral health provider, Southwest Center has behavioral health providers on staff that can write letters. Are there any specific doctors in the Phoenix area whom only do top surgery for trans individuals? Dr. Turkletop. Dr. Turkletop, Dr. Lay, and Dr. Meltzer all do top surgeries for trans individuals that I know of. There are also a whole bunch of other plastic surgeons. Like I've heard of my clients going to Dr. Robert Brown for transmasculine top surgery and breast augmentation. You have all of Scottsdale available to you. I personally recommend that you go to somebody who is at least somewhat nuanced with the trans community, because they're going to be able to help you get your surgery covered. So Dr. Turkletop's office is really great in that they require your behavioral health letter before they schedule the consult. That way you have no hiccups between consult and scheduling your surgery. Every time I call Dr. Meltzer's office, Dr. Meltzer and Dr. Lay's office, I am thoroughly impressed at the level of professionalism that their staff have around getting insurance coverage in order. So those are the big three here in the Valley. There's Dr. Larson and Dr. Taki in Tucson. I think Dr. Doyle is still practicing up in Flagstaff, and maybe Dr. Lex. There are also a whole bunch of clinics that, if you have a nationwide plan like Aetna or United Healthcare or Blue Cross Blue Shield, you may be able to go out of state. I know that some plans like the United Healthcare plan at Target will actually pay for you to travel out of state if that's what you need to do. So those are the ones who do top surgeries. And I know that Dr. Meltzer also does transmasculine and transfeminine bottom surgeries. So those are usually the top 3 go-to. As for, can you go to any doctor of choice within coverage? That's up to you. Personal experience. I went to a plastic surgeon who said that he had done top surgeries before. And he had on bodybuilders who were cisgender and never developed true breasts. I ended up with a botched surgery, and I had to go back a second time and ended up with a second botched surgery. And now I'm looking at doing a third surgery. I'm not playing games this time. I'm going to one of the more national clinics. I'm hoping to get in with Dr. Mosser, Dr. Garamoni, the University of Minnesota, or the University of Utah. I'm working hard to try to figure out coverage with that. If you feel comfortable with the surgeon and they have advocated their ability to do this surgery and they are familiar, like you think they're familiar enough with it and you are willing to risk your time and investment and body in that, go right ahead. I don't know why you'd be willing to take that risk without a lot of thorough due diligence, or you can go to somebody who, like at the University of Minnesota, I was there helping a friend recover from top surgery. And their surgeon had to go through, I think, 100 supervised surgeries with trans persons before they were allowed to do a surgery on their own. Do your due diligence with your surgeon. Do not trust them at face value. There are a lot of great surgeons out there, and there are some not so great ones. Just like there are a lot of great doctors, and there are some not so great ones. And trans surgeries definitely have parallels, like breast augmentation is pretty easy to do. I mean, we've almost perfected it in a lot of ways. But there are some considerations to be had if you went through a natal puberty with testosterone. There are some considerations to be had if you went through a natal puberty with estrogen. I am personally of the belief that you should get at least 3 consultations, and one of those consultations needs to be with somebody who directly advertises themselves as a trans surgeon. And if you're starting to notice a big difference between how the trans surgeon is explaining your surgery to you and how the persons who don't have as much experience, that tells you that your surgery probably needs a little bit more nuance and experience. It's a bit of a pain. It costs a little bit of money. Consults run anywhere from $100 to $300 a pop. If you're paying more than that, I don't really think it's worth it. But it's your body and it's your life, and you get to make the decision about it. Make it a good one. And do your work to figure out what that good decision is. If you need help, I'm here. Have there been any suits brought against the state for said discrimination? Are there any attorneys willing to take up the case? I do not know that. Off the top of my head, I really don't know, but I know at a place to direct you. Equality Arizona has been an absolutely great partner in working to get local representatives and senators informed. I know that they've worked on trans legislation in the past, like trying to strike down HB 2706, which was the discriminatory trans bill that was unfortunately sent from committee to the House. And I haven't been following it since then because COVID. But connect with local queer political organizations and see if they're doing anything about that. And if that's something you're particularly interested in, let me know, email me, and I'll see if I can facilitate that connection. Do deviated symptoms help cover FFS? They might. I don't know the process for every insurance company because this is America and we have thousands of insurance companies. But I have heard on different trans groups of trans feminine persons who have deviated septums getting the rhinoplasty part of their facial feminization surgery. And facial feminization surgery, by the way, is a misnomer. It's an aggregate of surgeries that can occur in 1 or 2 surgeries. So jaw shaving with tracheal shaving can occur at the same time. Nose shaving with cheek raising can occur at the same time. Forehead shaving and nose sculpting can sometimes occur at the same time. These surgeries can happen together, or they can happen in stages, and then those collectively, for the purpose of feminizing a face, a person's face, are considered facial feminization surgeries. So if you have a reason to get a rhinoplasty and you're working with a surgeon who will do the rhinoplasty and then will do nose shaving at the same time, it could possibly be covered. You may also be hit, though, with a cosmetic fee for the shaving. If the insurance company is looking through the payments and they see that you were there to get a deviated septum fixed, but they saw some cosmetic codes along with it, you may be responsible for the cosmetic portion of that. Best advice I can give is to file for a prior approval and a prior determination. And the prior determination should give you an estimate of the cost you are responsible for. Your insurance company will say that a prior approval is good enough. Ask for a prior determination, which is a letter from the insurance company that is an estimate of the cost you are responsible for. If they are not giving it to you, appeal up to the manager. Thank you, Jericho, for posting the resources for the different surgical payment programs. We have about 5 minutes to go. I feel like there were a lot of questions I didn't even get to, and a lot of persons who want to connect. So Jericho, if you can, throw up my email down here if you wanted to connect, or if you needed more help answering surgical questions. Maybe we need to break this into a part 2. If you have anybody, or you are a person who works with trans surgeries, say you work in a medical office, say you're a surgeon yourself and you want to be on this show, please reach out to me. I would love to have more than my voice here. I've helped hundreds of trans persons trying to get coverage for their surgeries, and I've heard their stories and their struggles. And we can go over the basics about all of it. But this is a really complex issue, and if we have to extend it beyond this video, so be it. I'm more than excited to. I'm thoroughly impressed with the level of engagement we've had, and I thank you all for coming here and being a part of this tonight. For anybody who needs help with transitioning, you can reach out to me. My email's right here. Also, I work at Southwest Center, which means that we have a whole bunch of other programs available to you. Thank you, Jericho. That was the URL I forgot, southwestcenter.org/transprogram. So you can reach out to my email. You can fill out a form there. We offer other services like HIV testing available to you at home, HRT care provided through our wellness clinic, behavioral health care, which includes surgical letters, so letters that you would need to get your surgery covered. We have life coaching available. We have free condoms delivered to your door available at Southwest Center. Thank you all so much for coming out to dip our toes into this really complex topic and for bringing all of your questions. Hopefully we'll be able to have a part 2 of this soon with somebody else other than me who can bring a new perspective onto this. Again, if you want to connect, my email, and you can also reach out to Southwest Center at swcenter.org or call our main number 602-307-5330. Final note, I don't think I do this enough. Thank you to all my coworkers and managers and staff who work at Southwest Center. Y'all make my life enjoyable. Like, you make my life difficult, but you also make my life enjoyable. So thank you to Mars, thank you to Jericho, thank you to Tony, thank you to Stephen, thank you to Gabriel, Dave, Carla, Giovanni, Adam, Andrew, Michael, Lisa, and everyone else who I'm not listing right off the bat because I think we'll get bored with names. Rocco, I can go on and on and on. Thank you for coming together and doing everything we do. And I encourage all of you to connect with them as well as me. Have a great night. Bye.